Hey guys, Andrew here, and today in this video we'll be discussing hair transplants. More specifically though, we will be answering the big question of, do hair transplants hurt? Now this is a question that I asked myself before I got my own hair transplant, but it wasn't something I had done a ton of research into. It was something I thought about personally, and I kind of thought, oh, it might hurt, it might not, but I kind of didn't really worry about the answer to the question because I was obviously convinced I needed to get a hair transplant. However, I've seen online that a lot of people do ask about this. You know, how much does it hurt? Is it painful? Is it painful during the recovery? So I'm trying to cover all three of those points. Specifically, how painful is the surgery itself? How painful is it immediately after the surgery? And how much pain was experienced post-surgery? You know, 1 plus 2 weeks, 3 weeks, all the way up to 6 months, a year. So, first off, was the surgery itself painful? For me, relatively speaking, no. The surgery itself is designed to be fairly relaxing and, you know, pain-free. Of course, you know, you are getting surgery done, so you're not going for a massage, obviously. So you are very much aware that you are having some surgery done at the back of your head, but you are given numbing agents and painkillers to prevent you from feeling any discomfort. So during the surgery itself, I was sitting in a chair, fully awake, watching movies, and doing that relatively comfortably. Now, when I got about halfway through the surgery itself, I did start to experience a little bit of discomfort in and around the front of my head and around the back. That was because the numbing agent that I had been given had started to wear off. Now when this started to happen, I started to get what's called like a compression headache, where basically there was pressure all around my head, because my head felt constricted, and it started to give me a headache. So I asked the nurse or the technician, I said, hey, I'm starting to get a bit of a headache here, I'm starting to feel a bit of discomfort at the back of my head and around the sides. And she said, okay, no worries. She gave me some more numbing agent, and just like that, pain was gone, and I was pretty much back to nice and comfortable. So just be aware of that. If you are having surgery done, don't feel like you can't say anything or speak up during the surgery. If you are starting to experience discomfort or pain, let the doctor or the technician or whoever's in the room, let them know that you're experiencing discomfort, and they can try and address the situation. Now the reason that I was starting to get a headache or a bit of pain and numbness is because, you know, I've just had surgery back in my head. You know, when I had the FUT method done, you know, FUT is where they take a strip of skin from the back of your head, peel it off, and then from there they use the hair follicles and then they stitch the back of your head together with staples. Now I know that probably sounds extremely grim, what I've just described, but that is essentially what it is. They are taking a layer of skin that starts basically around the side of your head, goes all the way to the back of your head, round to the other side. They peel that off, and then from that they take off the individual hair follicles, and then they staple that skin back together. And obviously when that happens, you've just stapled a piece of skin back together, it's going to feel tight, and that's why I got this compression headache, because my head felt really tight and the numbing agent had started to wear off. So in that regard, yes, was the surgery a little bit painful? Yeah, I wouldn't say it was painful, but it certainly got a little bit uncomfortable. So if what I've just described to you sounds absolutely horrific, and you're like, whoa, I don't want anything to do with that, then I would recommend looking into getting FUE done. Now FUE surgery is where they punch out the individual hair follicles one at a time from the back of your head, and there's no stapling, or there's no, you know, stitching back together the back of your head. However, just bear in mind that FUE is significantly more expensive. Again, that's why I went with the FUT procedure, because for me it was just significantly cheaper, and I just felt, just for me personally, I was happy to go with the FUT route. So definitely in that regard, just be aware that as far as pain wise goes and discomfort goes, FUE is going to be a better option if you're looking purely at discomfort and pain. Now, so covered that. Surgery itself, relatively pain-free. Immediately after the surgery, they give you painkillers to take when you get back to the hotel or to your home or wherever it is you're going after the surgery. However, me being pretty stupid, I didn't take the pain medication right away. For some reason I waited, and it was because I went out to get dinner and I completely forgot to take the pain medication, and my head started to really hurt, like really hurt. And yeah, I actually called up the office and I said, I'm in a lot of pain here. I've taken the painkiller medication, however, I've taken it about an hour after I was supposed to, and the nurse just said, unfortunately, you're just going to have to ride it out. The pain medication will eventually kick in. And it did. So basically, I endured about an hour of discomfort in my hotel room. Now, really important, guys, that was my own fault. I waited about an hour after the actual time they told me to take the medication. So if I had just taken the pain medication at the proper time I was supposed to, I would have been fine. However, I didn't do it, and I paid the price for it. I experienced about an hour of extreme discomfort. But after that, the pain went away, the pain medication finally kicked in, started to take effect, and it was all good after that. Now, looking at about 1 week, 2 weeks post-op, yep, I did experience a little bit of discomfort in the back of my head. Again, everything felt really tight in the back of my head, and again, that is because I've just had a layer of skin removed in the back of my head and it's been stapled back together. It's going to feel tight, it makes sense. You've got staples in the back of your head, it's not going to be all fine and dandy. But again, is it like excruciatingly painful? No, it's not. Is it like a pain that it's like kind of like, it's more like discomfort I would describe it as. And it's just like, you're just aware that it's there. Especially when you're walking, like you'll notice it like, especially the first few days afterwards. You've just had surgery in the back of your head, so the back of your head is extremely sensitive. Okay, so when you're walking, every time you take a step, you actually kind of feel that vibration in the back of your head. Again, not super painful, but it's a slight discomfort and you are aware that it's there. And of course, when you're sleeping, you are going to, you know, feel it at the back of your head. And especially when you touch it at the back of your head, when you do that at the back of your head, for the first like few weeks, it felt pretty numb. I didn't really have much feeling at the back of my head. And again, that's to be expected. As with any surgery that where you've had a layer of skin removed, you've had to be stable back together, it's going to feel numb, it's going to feel tender, and the back of your head is no exception for that. Going down the line, you know, looking at like 3 weeks, 4 weeks, a month, like a month, 2 months, and so on, you are going to start to feel that general numbness at the back of your head. It's not going to go away just like that. It does, at least for me, it hung around a little bit, that numbness. I would say the bulk of that numbness really started to go away around about the 2 month, 3 month mark. It started to die down, and then just from there it kind of just slowly petered out, and then I got feeling in the back of my head. Again, that's just my experience with it, and now of course by a year I was pretty much back to full normal at the back of my head. But even now, it's still, even now I'm 2-3 years down the line, and even for me now, it does feel, you know, sometimes it does feel a little bit, you know, it's not numb, but I would describe it as kind of, you know, I'm just aware that I've had surgery back there, and it's just, I can kind of just ever so slightly just feel it just a tiny bit, a little bit of like loss of sensation. But again, it's the back of your head, so at least for me, and he was like, who cares? It's like a little bit loss of sensation in the back of your head, whatever. It's not like if you lost sensation in your fingers, that'd be a big problem. But at the back of your head, not a big deal. Now again, this is my own personal experience, and bear in mind what I'm describing is my surgery and my experience with having the FUT method done. Okay, really important, guys. If you're having the FUE method, it's going to be significantly less discomfort, less numbness. Okay, because there is no removal of any layer of skin, there are no staples put in the back of your head, so there's no real healing at the back of your head to be done, because you're just having the individual hair follicles punched out one at a time. So again, keep that in mind when you're watching this video and try to decide what you're looking to do. Again, so I will emphasize that if you are looking at getting, you know, FUT, FUE, and you know, you're trying to figure out what's the best option, and I'm assuming probably the biggest factor to determine whether or not you're going to get one or the other done is the cost, because FUE is significantly more expensive. Again, in my opinion, if having the surgery done and cost is not a factor, in my opinion, I would go for the FUE method. However, if money is a factor and you want to get it done but you are on a budget, probably going to be looking at the FUT. Now, from my experience, would I do the FUT method again with the budget that I had? Yes, I would. I would still go for it. However, again, if let's say I had a lot more money at the time when I had the surgery done and I could have afforded the FUE, I would have just gone with the FUE. But I certainly, however, don't regret having the FUT surgery done. So again, guys, I hope you found that information valuable. Hope that kind of gave you a bit of insight into, at least in my experience. And again, I just want to be clear, the experience that I've had, take it with a pinch of salt. Just because I had this experience with it, don't just assume that that's going to be your experience. Any type of surgery that you have, everybody's experience is going to be a little bit different, okay? Especially when you're dealing with the skin and the body, everybody's a little bit different, so just keep that in mind, okay? But just to summarize, for me, I would say this hair transplant itself wasn't completely pain-free. I would say the recovery, it was a lot of more just numbness and general loss of sensation, sensation at the back of my head. However, that slowly did start to come back around about the 2-3 month mark, and then it slowly got less and less from there. Anyway, guys, that's my thoughts and insights on whether or not hair transplants hurt. Hopefully you found it useful. If you like this video, give it a thumbs up. Please subscribe, guys, so you get notification when I put up new videos and new content. And please leave a comment. Let me know what your thoughts are. If you had the hair transplant, let me know if it was painful for you. And if you have any questions, don't forget to send me a message. I will be happy to answer any question you guys have. Alright guys, have a good one. I'm out of here.